Welcome to Body Talk. Have you ever felt unwell and visited your doctor only to be told you need some lab tests? Did you know that how you prepare for these tests can significantly impact the results? If you've ever had a simple lab test, you might have thought that all you need to do is just show up at the lab and you're done. But even a small mistake like drinking a glass of milk or taking a stomach pill can completely mess up your results. Lab tests comes in many forms, like blood tests, urine tests, stool tests, and more. Each test has specific preparation requirements. Failing to follow these can lead to inaccurate results, misdiagnosis, or the need to repeat tests. In this video, we're going to dive deep through real-life stories to show you exactly what you should and shouldn't do before different types of lab tests. In this video, we will study 3 cases. Case study number 1. He's been experiencing stomach pain and digestive discomfort for a while. He visits his doctor, who recommends several tests, includes stool examination, Helicobacter pylori antigen test, and H. pylori antibody tests. These tests are used to detect the presence of a type of bacteria in your digestive system. For doing this test, you need to avoid some medicines and food. Like you should avoid gastrointestinal medications, including antacids for 48 hours before the test, and you need to avoid red meat and certain vegetables like broccoli and radishes, and iron supplements for 2 days prior. And ensure proper collection and storage of stool samples as instructed. Case study number 2. He's been extremely fatigued with body aches, especially in his legs. His doctor orders following tests: Wright test, 2ME test, Combs-Wright test, ESR and CRP tests. But what are these tests going to check? The first 3 tests are related to diagnosis of brucellosis. Brucellosis is a bacterial infectious disease that is usually transmitted through contaminated dairy products or meat. Before performing this test, the laboratory staff will take a detailed medical history from you, asking questions such as, has you ever been infected with brucellosis before? Or has anyone in your family had this disease? Or a question like, has he recently consumed unpasteurized dairy products or meat? And what symptoms do you have, such as fever, night sweats, weaknesses, and more? An important point is that these tests do not require any fasting or special dietary restrictions. However, the information of the patient provides to the laboratory must be accurate and complete. The other 2 tests, ESR and CRP, are used to check for the presence of inflammations or infections in the body. These tests also do not require any special preparation and are usually performed with a simple blood sample. If you're learning something new today, make sure to like the video and subscribe.